A severe asthma attack, um, I've never drowned before, but I think that's what it would feel like. At one point, I remember being on like 22 medications, and so we had to be right on top of it, or it could cause me to have a severe attack where I'd end up in the hospital. So I would fight that all the time. And one time I just had such a bad attack that it lasted for days. And so instead of enjoying our family vacation with our family, I laid in a bed. If it was windy outside, I couldn't go outside. If there was, we lived in San Diego, Santa Ana winds, I had to stay inside. I'm a deaf educator, so I teach deaf and hard of hearing students. And when you can't breathe, they can see that on your body. And so you're not being able to educate as well. I was always at the ER. People knew me when I walked in. Nurses knew me because it was just all the time, at least once a month, if not more. We just kind of rolled with the punches, just were flexible. If something happened, we just dealt with it and prayed that I didn't die. When I first thought or was told about bronchial thermoplasty and what it entailed, it was interesting. The biggest seller for me was that it was a one-time thing. They did all the testing and they're like, you are a perfect candidate. Like, your lung function shows that, your lifestyle shows that, all these medications, you're a perfect candidate. I said, let's do it before anything else happens, let's try it. So the first few months were just shocking. I now kind of forget that I have asthma sometimes. There was so much like small things of my life, I was noticing it all the time. And my quality of life has skyrocketed. My bucket list just got like bigger and I started just checking off things like skydiving. I would have never been able to do that before. So now I can live life and go and do those fun activities that I hadn't done before. If you really want to live life and you really don't want a disease that's controlling your life or defining you, have BT. I would compare BT prior and post as life-changing. It's no longer controlling my life. It's as if I have life now. With BT, my life is awesome.
As with any procedure, there are risks, and individual results may vary. The most common side effect of BT is a temporary worsening of respiratory-related symptoms. These events typically occur within 1 day of the BT procedure and usually resolve within a week with proper care. There is a small risk that symptoms will require hospitalization.